ahead and hit record. Welcome everyone. Thank you for joining Amethyst at Penn's September 2025 seminar. We're proud to offer this content through our Amethyst at Penn Hub. Funding for this hub comes from the NIH's Improve Initiative, which aims to reduce maternal mortality, improve pregnancy, perinatal, and postpartum care, and to address the factors that have led to severe disparities in outcomes for marginalized groups. As a reminder, we will be recording this discussion and it will be available on our YouTube channel for review after the session. Please feel free to put any questions in the chat, and there will also be time for additional questions at the end of the discussion. This month, we're very fortunate to have Emily Pfender here to speak with us about how to use persuasive and strategic communication for policy impact. Dr. Pfender is a postdoctoral researcher with Amethyst who has a background in health communication and specializes in how social media impacts women's health. We're also fortunate to be joined by Julia Hinckley, the Director of Policy Strategy for Penn's Leonard Davis Institute of Health Economics, who's here to help us contextualize the discussion to real-world policy settings and to answer questions from our attendees. So we want to thank you both for being here. And with that, I will turn things over to Dr. Pfender to get us started.
Hi, everyone. Can you hear me okay? Okay, perfect. I see some head nods. Welcome. Thanks so much for coming on this Friday afternoon. I'm Emily Pfender. As Casey mentioned, I'm a postdoc with Amethyst, and my background is in health communication. And so I study how messages impact health behaviors. And so a lot of what I draw on is based in the persuasive communication literature. And so we're going to be adapting some of that today to talk about how strategic communication can actually impact policy. So, just to get us started here, I did want to mention a disclosure. I will be talking about social media as prime examples of policy impact throughout the presentation, and I do actively monetize and work for Instagram. So, I did want to make that disclosure. For today's agenda, we'll be reviewing an example of communication's potential for impacting policy. We'll do this through a social media example. Then I want to review some scholarship on policy communication and recommendations for best practice. Then we'll define persuasion and influence and review some persuasive theories and principles that might be relevant to us looking to make impact on policy. So, as Casey mentioned in the intro, my specialty is really in examining how messages on social media impact health behaviors and outcomes. And what we're seeing right now, for one of the examples, at least that's relevant to policy, is that there's a trend of influencers on social media talking about and documenting pain that they've experienced during IUD insertions. Most of these videos are getting extreme reach. Here you can see this person's talking about getting an IUD to come with them to the experience. They say that they see God. It's very painful. And notice in the left-hand corner, 1.3 million likes on this video. So really, really wide reach. We're seeing women say that it's the worst pain imaginable, and this is why women are recording these IUD insertions and posting about them publicly. We've also seen providers and physicians joining this conversation as well, right? Blocks. This reel received 4.4 million views, also getting very large reach, indicating that it's an important topic. And on the cover of the reel, she says, "You are not a transaction." Now, in August of 2024, the CDC updated their guidance and practice recommendations for IUD insertion. They included a couple of things that people could do to make the experience more comfortable. Many of the news outlets reported on this widely, saying that the policy update was actually influenced by women talking about their experiences and recording these insertions on social media, as well as empathetic physicians talking about this on their channels as well. This is just one example of how powerful communication is and how effective communication can really change medical recommendations and policies. But I think the larger question here is what message features and what strategies are these women using in these reels? How can we leverage that? And what are some of the, guiding frameworks we can use to be persuasive so that we can have this type of impact? And so we'll talk about policy broadly, not just as, laws, but also as organizational level decisions throughout today's talk. So I want to start by grounding us in some of the policy communication scholarship. And the story really starts with how do policymakers process information? And policy communication scholars argue that people use what we call heuristics or mental shortcuts to process information. And so they actually call policymakers cognitive misers, and they call them irrational because just as human beings do, we tend to draw from emotions, gut feelings, values, habits, or anything that's familiar to us to make decisions in a really quick, rapid environment. And policymakers need to gather information quickly and effectively, often because of these charged political atmospheres. And so they develop these heuristics that allow them to make what they believe to be good decisions. And so policymaker scholarship gives us alternative approaches to interacting with these folks. And they give us three recommendations in the literature. The first one being to understand your audience and tailor your response. This is really central to the communication field. Second, to identify windows of opportunity. And third, to engage with real-world policymaking rather than waiting for a rational and orderly process to appear. And this third one is really about relationship building. And so we'll talk about each of these three things and what the research says. So the first one, going back to understanding your audience and tailoring your response. They give us a couple of guiding frames for how to communicate with policymakers. The first one and most important one being to minimize working memory load, using things like bullets, bolding keywords, using a clear structure in our communication with them, using multiple coding, so a combination of text and visuals to increase retention when people are consuming short briefs or short one-page papers that we're sending to them. Repeating key messages. What we know in communication is that repetition aids transfer to long-term memory. And so repeating those messages a couple of times can be quite useful. Telling stories and giving specific examples. We'll talk about telling stories and narratives in a little bit, but this is really just to help encode information through emotional connection. If we go back to the idea of heuristics and making quick decisions based on things that are familiar and emotionally resonant, that would tell us that stories can be quite impactful. And then also considering fatigue. So we want to frame messages when energy and attention are available, which leads me to primacy and recency effect. I teach this in public speaking. I've been teaching public speaking for 7 years, and we really focus on the fact that the audience is primed and most attentive in the beginning of a communication and at the end of the communication. And that's where we see the importance of repetition as well. So telling the audience what you're going to tell them in the middle, telling them what it is, and at the end, telling them what you've already told them, even though it can feel quite repetitive. We also have tips for making messages stick. So we've seen in research even things like the fonts you choose, the colors you use, how messages and information and images appear on the document can really leave a lasting impression. Repeating keywords or visuals, keeping things simple and using cues to guide attention, what we call priming, can really help the message stick. We also know that giving people too many options can actually make it more difficult for them to come to a decision. And so giving people fewer choices can make it easier for them to decide or act. We don't want to overwhelm the reader and the message receiver. Now, there's more to it with understanding your audience. There's this really great scoping review of 139 studies published on literature and health, climate, and their intersection that focused on strategies for communicating with policymakers. They said to tailor your messaging to the target audiences. And one of the examples that came out of this study was that they found that legislative staff preferred a story-focused brief, whereas legislative staff preferred a story-focused brief, whereas legislators themselves preferred more of a data-focused brief. Now, this might vary based on the context. This context came from cancer-related information. The second thing that comes out of this is message content recommendations. One of those things was to share economic costs or benefits and public opinion polls. The public opinion polls we'll talk about toward the end of the presentation in a little bit more detail, but that's really getting at the idea of social proof, which is a persuasive and influence strategy in the communication literature. And it's based in the idea of showing that other people support your point of view will increase the persuasive impact of the message. They also talk about using a narrative style, again, going back to storytelling and telling stories about people and researchers to increase those emotional appeals. And then finally, they talk about the channel. 11% of the studies in the scoping review noted the importance of using multiple communication strategies and channels. The channel is just the mode through which we send the message. So approaching them from different modes of communication or channels of communication can be beneficial. Now, I talked a little bit about emotional appeals. I've said that a couple of times now. And there are communication frameworks that really take into consideration how we can strategically use emotional and fear-based messaging to alter behavior. We see this a lot in the health behavior literature, especially in the work that I've done. And one of my favorite models for understanding this is the extended parallel process model. I'm just going to walk us through what this means, and then I'm going to give an example of how we could directly apply this to communication with policymakers. So, the extended parallel process model says that when it comes to fear-based messaging, we need to present a threat. Now, if the threat is low, I'm starting at the top of the image here, typically what we see with behavioral response is little to no response. And so the model recommends that we use threat-based messaging to impact behavior. And what we see is that when a high threat message that induces fear is paired with a low efficacy message, people tend to engage in defensive motivation and fear control, which is maladaptive. We don't see the health behavioral response that we want. However, when a message with a high threat and fear-based component is paired with a high efficacy message, the ability for the person to enact the behavior, we see protective motivation and danger control, which is adaptive in health contexts specifically, but can be applied to other contexts as well. And so, according to this model, the most effective message should be a combination of moderate to high perceived threat and an efficacy component. So, we want to induce fear, but also tell people how they can handle that threat. Now, there is a U-shaped curve here. There's a lot of speculation and criticism around using fear-based messaging, but what we know is that uh, it can be primarily ineffective when we are too intense or frightening, and that's when it can backfire. Health psychology and communication research shows that overly vivid threats, typically we see this in like fear of dying from smoking campaigns, may cause people to shut down or act defensively, but in the literature, these are quite effective for persuasive communication. So you might be wondering, how is this even relevant or helpful for me? Well, if you're communicating with a policymaker or someone that you want to alter their behavior, using some of this fear-based messaging could be quite helpful. So, when we think about perceived threat, we think about two components. The first one is severity. You want to point out how serious the issue is, whether this is maternal mortality rates, economic costs, racial disparities, point out the severity. The other component associated with perceived threat is susceptibility. Is this issue happening in the policymaker's district? Is how we can tailor the susceptibility component. Is it under their oversight? Could they be held accountable? Now, the other component here that we talked about was efficacy. There's two parts of efficacy in this model. Response efficacy. Will the proposed action or policy work to solve the problem? You want to communicate that and explain how that works. The other thing you might want to consider is self-efficacy. So, encouraging the policymaker, how can they personally take effective action? What does that look like? What's the behavior that you're trying to get them to do? And so those are the two components and how they could be used and how we could leverage this model and also fear-based messaging. Now, the second thing in that scoping review that they talked about was identifying windows of opportunity. And what they mean by that is when attention to a policy problem arises and a feasible solution exists, policymakers have the motive and opportunity to select it. And what they really emphasize with identifying windows of opportunity are creating urgency and also centering your communication around a focusing event. So if you want to grab attention, you want to tie your message to something immediate and emotionally charged. And this is the definition of the focusing event. So, for example, if there's a recent news story or a crisis that relates to your issue, you can use that to frame the urgency and the importance of your issue. It helps the policy concern feel real, it helps it feel urgent and close rather than abstract and far away. I often even do this in my research. I do a lot of social media work, and so I talk about problematic trends that have caused harm in the general population and use that as a focusing event to talk about why my research on social media is important. And I often just do that in the introduction to create that sense of urgency and provide a focusing event. Now, the third thing that they talk about in the scoping review is really this focus on developing and forming relationships. They say that we want to form relationships with networks and policymakers and people associated with those groups before presenting challenging information, because doing that without established trust can actually be counterproductive and backfire. And so they talk about identifying influential people that you would want to build alliances with so that you could choose the opportune moment to act. They also find that 19% of the studies in that scoping review recommended that communicators seek to build long-term and trusted relationships with policymakers, their staff, and other people that are influencing policy. Now, I think one of the most difficult questions that comes out of this is, well, how do I make those connections and how do I build those relationships? And one of the things that I'm noticing, both as a person who uses social media and as someone who studies it, is that policymakers are being more and more active in the social media landscape. Recently on Instagram, where I share my research, Dr. Kelly Morrison, who's a congresswoman in Minnesota, she's also an OBGYN. She noticed my women's health misinformation studies and content that I'm posting on social media, and she reached out to build a connection with me, to build a relationship, and to potentially collaborate on some work in the future. And so they are in these digital online environments looking to build connections with people that are also talking about their research and their work. And so that's one way of doing it. Now, those were the three recommendations from the policy communication scholarship. Now, I want to spend some time talking about persuasion and influence. Specifically, this book. This is one of my favorite books that I've ever read in the communication space. And it's called Influence, The Psychology of Persuasion. It's by Robert Cialdini. I talk about him in all of my communication courses with students and find that this information is science-based, but it's also pretty relatable and easy to kind of use in your own work. Now, when we think about persuasion, I think that a lot of people automatically assume that we're changing beliefs, that we're trying to change deeply rooted behaviors and beliefs. But a lot of the persuasion and influence literature is actually focused on reinforcing beliefs that already exist because someone might have be on the fence about something, and people tend to be more open to things than we would anticipate. And so a lot of this is actually reinforcing rather than completely altering beliefs. Those are the people that we often reach in our communication. And Cialdini says that there are six principles that we can leverage that are based in science to influence our audiences. I'm going to go over all six. Those are reciprocity, scarcity, authority, commitment and consistency, liking, and social proof. So the first one is reciprocity. This is the idea that humans are hardwired to want to return favors, pay back debts, and treat others as they have been treated. And what's really cool about reciprocity is that it really is valued across cultures. And so what we learn from this is that in essence, do something for someone else and they will likely return the favor. And so giving is influential. There's some science behind this. A university professor in a study sent out Christmas cards to complete strangers. And what happened was holiday cards addressed to him came pouring back from people who he didn't even know. They reciprocated the favor without really thinking about it, which suggests that reciprocity is an automatic human response. People are more likely to say yes to someone they owe. Studies also show that when a server leaves a mint or candy with the bill, they get significantly higher tips. In one study, one mint increased tips by 3%, two mints increased tips by 14%, And then they altered how the server delivered the mint. So they provided a mint at the table, walked away, and then came back and said, and for you, here is an additional mint for the table. And when that happened, tips increased by 23%. And so the way the gift was given influenced the outcomes. And so what we can take away from this is that we want to make sure that we're giving someone, when we're giving someone something, that it's personalized and unexpected. In another study, they looked at the effective timing of giving a favor on reciprocity. And so, what they did, it was at a McDonald's in Brazil. They had researchers giving balloons to families as they entered or as they exited the McDonald's. And the families of the children that received a balloon as they entered the McDonald's spent on average 25% more than other families. And so the timing of the favor really matters here. And so we want to give something to the person we're trying to attempt to persuade. And honestly, for researchers, this could be as simple as something like your time or even a service. Here's scarcity, the second principle. This is basic supply and demand. The less there is of something, the more valuable it can become, and the more people want it. Some science behind this. In the early 2000s, British Airways announced that they would be no longer operating a flight because it wasn't economical to run anymore. And after that announcement, sales took off the next day. Nothing changed except for the fact that it was now a scarce resource. And so it's not enough to simply tell someone the benefits of your suggestions or the benefits of your research or the policy you're recommending, but you need to point out what's unique about it. And that's what's ultimately going to drive influence. We also have authority. This is the idea that people follow the lead of credible, knowledgeable experts within reason. There's some science behind this. They did a study on physical therapists and looked at how likely patients were to follow their exercise recommendations for their physical therapy. Those PTs who displayed their diplomas and credentials on the wall, their patients were more likely to follow the exercise programs. Before we had apps for parking, studies also found that people were more likely to pay complete strangers as long as they were wearing the parking or police officer uniform. Another thing about authority is that it helps when someone introduces your credibility. So, in a study about real estate agents, they had a receptionist answer in two ways. In the first way, the receptionist would say, "Oh, let me introduce you to so and so," and go over their credentials. They have 30 years of experience, they're really excellent, our clients really love them, versus the receptionist who would say, "Oh yeah, let me connect you to so and so." And what the difference was that those that were introduced with all their credentials and really talked up, those introductions led to a 20% rise in appointments and 15% increase in signed contracts. So what we learned from this is that it's important to signal what makes you an authority before making your influence attempt. And it can be even more impactful when you get someone to make that connection and introduction for you and talk about your experience for you. Number four, we have consistency. People really prefer to be consistent with things that they've previously said or done. So when you tell someone that you're going to do something for them, typically people like to stay true to that and be, I guess, what we would call people of our word. And what we also know is that consistency is activated by asking for initial commitments that can be made. So if you ask someone to do something and it's a small ask, typically after that you can ask for a larger ask. We have some science on this. In one study, very few people were willing to put an unsightly sign about a campaign in their yards. However, in a similar neighborhood, researchers found that 4 times as many people would be willing to display the unattractive sign. And the reason was because 10 days previously, they were asked to put a small sticker of the same campaign in their window. And so that small sticker in the window was an initial commitment, and that ultimately led to a 400% increase in people saying yes to displaying the sign that was very unsightly in their yard. Another study showed that a health center reduced missed appointments by 18% by having patients write down appointment details themselves rather than writing it for the patient. And so when we seek to influence, we should look for voluntary, active, and public commitments and ideally get those things in writing because people will feel more likely to follow through with them. Number five is liking. People prefer to say yes to people they like. That sounds pretty reasonable. But what causes one person to like another? And the persuasion science literature tells us there's three important factors. The first one is are we similar? The second is do they pay us compliments? And the third is do they cooperate with us? So we have some science on this. They did a study with a series of negotiations carried out between MBA students and business schools. Some groups were told time is money, get straight down to business, find an agreement. In that group, 55% came to an agreement. However, in the other group, they were told before you begin negotiating, exchange some personal information and identify something that you have in common. That group, 90% came to a successful agreement. So we want to be sure to look for areas of similarity, point out those similarities, and share that information with people before making requests. And then number six, consensus and social proof. When people are uncertain, they look to others' actions and behaviors. And we see this with behavioral change interventions. My team and I did a study on binge drinking at the University of Delaware. We did a campaign and in a survey, we found that students assumed that others were binge drinking, like even 3 to 4 times per week, but many weren't doing that or even drinking at all. And so we used these statistics on the campaign to increase social norms about what drinking actually looks like on campus. Also, notice this principle explains why the IUD viral social media policy updates occurred. There was so much public evidence of the issue of pain mismanagement. And so, to use this principle, we need to tell people what others are doing. I think sometimes people push back on this social proof and say that it could be a logical fallacy, but we do know that when we point out, at least in an ethical way, that other people approve of a behavior, the social norms can be quite influential. Notice this was recommended by the policy communication scholarship we went over in the beginning of the seminar when I mentioned that they were encouraging the use of public opinion polls in the policy briefs. That's social proof in action. And so we should point to what others are doing, and especially people who are similar to us. So, just to wrap up, we've been introduced to the science of persuasion, how policymakers process information, why it's essential to reduce cognitive burden, how timing, emotional framing, and relationships all influence what ultimately becomes policy. We talked about Cialdini's principles of influence and fear-based messaging and the extended parallel process model. I think if there's one key message I would just like to leave, it's that policy doesn't just come from data. It comes from communication. A lot of people say, "Oh, I've been communicating my whole life. Why would I need strategies for that?" But communication really is a critical tool for advancing health equity. It shapes institutional practices and policies, and it really helps us get evidence into action. So thank you so much for being here today. I'm happy to answer any questions along with Julia, who'll be helping from the policy landscape as well.
Thank you so much, Emily. That was a wonderful presentation. Um, I will turn it over to the group. Um, um, does anyone have any questions? Please feel free to put them in the chat, to raise your hands or come off mute, whatever people feel more comfortable with. Yes, Asta, go for it.
Thank you, Emily. This is so incredible of a presentation. I'm like really interested in this kind of work. I had a question about the work that you had shared around like authority and authority figures and like people being more likely to listen to them. Like, do you feel like, because I've noticed sort of anecdotally that it seems like people are less interested in like experts in different types of things, or is that truly like, is that just a feeling I get and then reality that human behavior hasn't changed? Like, or is there like updated stuff there that I can point to?
Yeah, I think that's a great question. I think that so the principle I do believe is important because especially as like young kids, we're taught to like respect and interact with and trust like teachers and authority figures. And that's where this concept really comes from in that like persuasion literature. But I would say, and as I was talking about it, I was thinking about this, that in today's landscape, especially because of the political landscape, I think we're seeing less trust in science and less trust in authority figures. But I do think that there are still people who are interested in authority figures. And so it's kind of a tough balance. I will say that, as someone who's very active on sharing science on social media, I would never open or reel by saying that I have a PhD because it's going to turn people off right away. But I can hook them with something that's more emotionally charged, get them interested, listen to the whole thing, and then they come and see that I have a PhD. And I feel like that is often an easier way to kind of introduce people to evidence and science. I hope that kind of answers the question.
Yeah, that's really helpful. So like not lead with like the background, but more so like maybe the background keeps them continuously engaged, like over time, like kind of like developing messages that way. It's yeah.
Yeah, that's what I've been seeing. That
Yeah.
sometimes leading with the credential immediately turns people off. And so I don't do that anymore with my public communication. But I know that some people would say that, oh, well, I don't want to listen to anyone that's not an expert. But we're seeing such a shift in the way people view experts, and trust in science is definitely a major issue right now. So I don't do that.
Thank you so much. That answers my question. I appreciate it.
Awesome.
Thank you. I apologize if I mispronounced this, but Evelyn.
Can you all hear me?
Yes.
Yes.
Okay, thank you so much for the wonderful presentation. I really enjoyed it. But I have a quick question, and I've been keeping it for the longest time, so it's an opportunity for me to ask that. So you used storytelling in uh, regarding your presentation when you're trying to explain about policy implications and all that. But most times I hear something like, "Oh, you don't just need the storytelling to get policy done," right? Some persons or some groups believe that you need data to do that. And sometimes some tell you, oh, you don't need the story, just get your data. And at a point, I got confused. So I just want to ask, what is your take on that? Do you think that there are circumstances or situations you storytelling is okay, like to get you to where you're going to? Or do you think there are cases where you just need the data to get what you want? Or do you think both should be meshed together to get what you want?
Yeah, I think that's a great question. Julia, I feel like you would be a really good person to comment on that if you don't mind me calling you out.
Yeah, it's interesting. I mean, I was going to ask you a question about off of Asta's question about authority figures and how people react. And I was going to ask if it was generational, which I think you kind of answered that slightly. But I do think that, my advice to people usually is because you might not be sure exactly, you're trying to target your audience, but you might not be sure exactly whether you have and you gave the example of like legislative staff. And again, this might be generational, which was interesting. I had not heard like that legislative staff preferred stories and the legislators preferred data. And I'm wondering if there's some generational stuff there too. And so my approach to folks is usually just to try a little bit of both because um, you may not be sure what's gonna stick. Uh, but yeah, I think it's and figuring out the best mix of, and also like if you have limited time, which to lead with, are all um, uh, key questions for folks when they're figuring out how to frame something.
Yeah, I think the gist of what I like, especially from the policy communication scholarship, was really like the more information you can get about who's going to read it, the better off you are. And that's a hard thing to do. We don't always know who's going to be reading it, but it definitely has an impact on how it's perceived. I think the generational thing is really interesting. I would say that younger generations are probably more story focused. Even when I'm doing like science communication online, like I would never use numbers and statistics. Like instead of saying like 75% of influencers recommend the discontinuation of hormonal contraceptives, I would say most. They don't do well with the data in the same way. And so I could see that being part of this as well. It's very complicated and kind of hard to know where your message is always going.
Yeah, thank you so much. That answered my question. But in addition to that, I just want to ask, is there a point where they would require you to get the people that are being affected as an evidence to that in the case of storytelling? Let me give you a background where maybe someone had bad experience while receiving medical treatment, for instance, and maybe you're advocating for that. Do you think there will be a point when they need you to get the person to make sure that what you're telling them about in the story is true, or would that have anything to do with breaching the privacy or confidentiality at that point?
That's a great question. I've actually never been in that position, so I don't know if I can fully answer that based on personal experience. I mean, it does kind of remind me of when we're, working with qualitative data. Like one of the things that I would do if I was interviewing is send my interpretations of the data back to the participants to like as a verification process. But I think that when we're thinking of like a focusing event, it's just like a general story maybe that was in the news that you could kind of verify in that way rather than reaching directly out to the person. I don't know, Julia, what do you think of that?
Yeah, I don't think I mean, I've never encountered that either, which is not to say though that particularly in today's environment, when if things got heated, that someone might ask for more proof. But yeah, I agree. I think it's fine to use, like Emily said, like cases from the news, or you could say like this is a composite case from people that I've worked with. I think it's fine to communicate something, and even if you're not willing or able to be able to like go back and present the actual person.
I wonder too, for this particular question, Ms. DeBoer, if you're able to come off mute, as someone who's on the patient storyteller side of things, like if you have kind of potentially the other perspective of how you would feel in that scenario, like mentioning, a breaching confidentiality or things, have you ever been approached in that way of you've shared your story and someone's followed up with you of, can we identify that it was you or can we ask for more information? Like what would your perspective be if you have one?
Hi, good morning. First of all, I just want to say, Emily, this is so powerful and it's very beneficial to me to hear this as a patient storyteller. And I want to pick your brain later on if possible. But from the perspective of going into a room and have I ever been questioned about some things? Yes, it's always going to happen. I always, of course, preface it by saying I'm here to really share my lived experience. This is what I encountered. It's always important to make sure that that's articulated to the group. And the power of the story, of being able to recall a lot of the different things and sharing them with people, it's great, as we already know. But there will be times that someone may question something, especially when it comes to understanding the variations of heart disease, because of course where my story, is. And then the maternal health side, I've been questioned about that as well, like what led to being in intensive care and those kinds of things. So again, it's about the authenticity of the story, and it's think always going to have somebody who may not understand, or there may be some concerns about what you're saying. But there's always a professional who can back it up. Usually, if I'm doing a presentation, there's a physician on call or that's available to talk about some of the things that I'm not unable to talk about on the medical side. So just having all of the ducks in a row and having that follow up with someone else is always helpful as well.
Thank you so much. We have a question in the chat. The question is, I'd welcome your thoughts on how we might interest policymakers who are not Black or people of color in first believing in the data about systemic influences on the Black population's well-being and then making changes given the effort and many steps that are needed to make change?
That's a great question. Sorry, I'm just like reading the second piece again just so I make sure that I got it. So I will say that I haven't had any, I want to lead with, I haven't had any direct experience doing this. So everything that would say is just based on my work in behavior change and communication. I think that this is where the combination of stories and statistics really comes into play, and giving them a couple different ways to kind of look at the scenario holistically rather than just targeting them with just data. Because some people, like we talked about earlier, respond to different forms of communication. And so that could definitely be part of the equation here. I don't know, Julia, would you add anything to that?
Yeah, no, I think that's right. And the one thing I would add is, and I have a little bit of experience, well, more experience than I would like with this, working in different levels of government. Is adding concreteness where you can, like specificity. So like I'm thinking about like the one, one thing that I think that has really gotten the American public to understand what we're talking about when we're talking about systemic racism and the impacts is like redlining. Like people can wrap their heads around that specific practice and then what that might have done, versus like, sometimes the issues feel so big, and then the ways of going about fixing it feel insurmountable also. And so my only other suggestion, as Emily said, like between the mix of personal stories and data, and then like concrete where you can, giving concrete examples of the policy, the policy that's harming, a policy of harming that is harming, and then as an example, which is not to say you're not going to be able to enumerate all the ways in which, and then concreteness in potential ways to address that. If that, I don't know if that is helpful, but that's kind of one way that I think about it.
Yeah, and I would add that I think that showing studies that have been replicated over different time periods to also make that point. I often I teach interpersonal communication, and we often talk about social construction and race and systemic racism. And the thing that I show them every semester that always I think actually reaches people is the doll test. I don't know if you're familiar with that study, but it was with children, and they were asked to point to different dolls of different racial backgrounds. Who's the pretty doll, who's the smart doll, and so that I think what's so powerful about something like that is that it was done in the 1940s, it was done in the early 2000s, it was done in 2021, and shows showing that trend over time. I think really reaches people, at least just in like the classroom environment. I think that kind of extends to this in some way, but showing trends over time could potentially help as well with data.
Thank you so much. We had a question come in ahead of time. Um, that was, what is the most difficult aspect of your work or translating your work for communication purposes? And then how do you make your methods accessible to researchers? So I don't know if the person that asked that question is on the call. So if you are, please feel free to jump in. But if not, I'll turn this over to the both of you, and I'll put the question in the chat as well.
Hmm. The most difficult part of translating my work. I mean, I'm assuming that would be like translating my research for different audiences. I think that we live in a world where people want really, really quick information. And I experience this in like digital communication, but with different audience as well, whether that's teaching or working with other researchers. And I think that long form content and information is no longer the desired approach. And so it's learning how to distill that information into quick bite-sized pieces so that people are more likely to engage with it, has been the biggest challenge for me.
And I was going to say, this is a slightly different question, but I'm going to answer, is that like of the things that Emily talked to us about how to use the evidence and effectively communicate with policymakers, I think maybe one of the most difficult ones to do or live with is the whole developing relationships piece. I mean, it ties into what you just said, Emily, around people are impatient, but it's also like you can't create a relationship with a policymaker overnight. And so therefore, whatever your, policy advocacy communication work you're going to do is probably not going to yield results immediately. And so that's one of the most difficult things for people to understand, because usually when they come to this point and they're like, okay, I've got research, I want it to influence policy. And if you start then, that means you're starting the beginning of your relationship building journey with with the policymaker or with the congressional staffer. And it's probably going to require time and persistence before you actually yield whatever the changes that you're asking for.
At that point, Julia, as you work on building relationships with policymakers, what is too much? What is not enough? Like, how have you navigated, understanding that there can be variety based on the policymaker, but how have you navigated and what have you found successful in building those relationships and the frequency of that communication?
Yeah, I think it's an art, not a science. So like it is, um, thinking about ways to be in, regular touch. Like, hey, the study came out. I was like, it made me think of the work that you guys do. I mean, so I have to just also like endorse Emily's, her tips generally about, people want to be, and so many things that I've advised people on, but I came at it from what I've observed in my bosses and in myself and how they receive information. And here she comes along with literally studies that and technical terms for what I've observed. Including down to the one, I was like listening to all of it. And I'm like, wait, okay, but she hasn't said that people like to be complimented yet. And then she was like, and people like to be complimented. So sending an email that says like, hey, we saw that you show that you are paying attention to what the office is doing, and and then you're sending along something and you're not making an ask that time. You're just like sharing FYI information that doesn't require anything of them. But to Emily's point about reciprocity, like they've noted like, hey, oh, that was nice. That person like sent me something. They're not even asking me for anything right now. But you've earned a little chit that you might be able to cash in later. And so we do, like to your question about like how much is too much, as long as you're doing stuff that doesn't require too much action on their part, like you're not asking for a meeting every week, or you're not, I don't think you have to worry too much about that. We do sometimes like say to each other, my colleague Katie's on, like, is this too many emails for them to get from us? And you can also take your cues, right? Just like in the rest of the world, like when people say thanks, like that's better than if they don't respond at all. So there's no like magic to it, but I would say like the one thing might be to think about it, to the extent that you're not making asks, you have a lot more latitude in your being in touch with people, versus if every time you're in touch, you're trying to say to them like, hey, here's this research, why don't you take this action right now? So
Yeah, that absolutely makes sense. And in a similar vein there, one of the things that we've thought about specifically as Amethyst, we're a 7-year project. Our centers that we're partnering with are long-term projects. And I think a lot of people tend to think about communication and dissemination at the end of research,
yeah.
when it can be equally as important throughout. And so in that vein, is it ever too early to start building those relationships, or the earlier the better, thinking, you're not always making asks when you're starting those communications,
Yeah.
but I'm going to be done this in 5 years. And I think at that point, I'm going to be ready for some action, but is it productive to start then? Is that too early? Kind of, what are your thoughts there?
I think I don't think it's too early yeah, and I think it's good to start early, especially with low energy, low asks on their part, including like I like to take researchers to see people I'll say like, oh, so and so is working on their work and they're just building their, some of the research questions. And so like we wanted to consult you as a policymaker about what would things of interest be um, to you, knowing that we won't know these answers for 5 years. But we know that you're active in this space. Like, are there questions that you have that, I mean, you can't overpromise, because if you're not able to actually make adjustments to research, you don't want to like pretend like you can. And then, but I do think that early engagement is good. I will say though, like, as I'm saying that out loud to you, there were times when I would go, like, I'm thinking about when I worked in the federal government, where people would come in for their meeting, their big meeting in Washington with the federal policymaker. And they get their 30 minutes. And then I would go to the meeting with my boss. And then I'd be like, and what was the purpose of that? Because I was like, where was their ask? They didn't have a crisp ask. They didn't. And so like, if you're going to ask for an in-person meeting, you know what I mean? Like, it's like, if you're going to ask for an in-person meeting, you want to have an actual thing. If you're going to do just a phone call, if you're going to just send an email, like you don't need to be as prepared, or you don't need to. So you want to be conscious of like not wasting people's time and starting too early. But if you honestly do want to ask them for their input on how to design something, or, who to consult, which stakeholder groups in their state to consult to get whatever, like, I think that's great.
Yeah, absolutely. That makes sense. We did get a question in the chat. Do you have any tips or suggestions for diving into taking your research information to social media? It feels a bit of an intimidating realm to enter without experience, but important and useful since most people don't get their information from medical journals where the information has always previously lived. So, any tips there?
On social media, and specifically on places that are based on an algorithm like Instagram, the first 3 seconds are the most critical. If people don't watch past the first 3 seconds of your reel, the algorithm's not going to push the content out. And I would say the whole goal of disseminating research on social media is to have wide reach and to get people interested. And so the hook, the first 3 seconds, whether that's a visual hook or a verbal hook, typically, like, I just recommend that you say something pretty, spicy in the beginning to really hook people in, to get them interested, something emotional, something controversial within reason. You can still be professional and evidence-based by using a hook like that. But I would say that the other thing that works really well for me is combining it with something that like the general public is interested in. So people are very interested in fashion, and I have the best luck on social media presenting evidence-based information and study findings in combination with like my outfits, which is kind of funny. But my fashion and science combination content gets the most reach, or hairstyles or makeup or something like that. It's kind of funny. But if you can bring those two things together, it really does pull people in and gets them more interested in science, at least in my experience.
Yeah, thank you. Those are awesome, great recommendations. Also, hi, I'm Emily. Great to meet you. I think that is just, yeah, the piece you mentioned about how to just get people to stay on your video is super helpful, because even myself, as I'm a user on social media, if something feels too heavy right away, depending on the mood I'm in, I will just keep moving. So I think that also is a great suggestion, that in addition to your first 3 seconds being important, tie it into something else that people are interested in, which I can imagine is really a challenge. But I think that those are both great suggestions. Thank you.
Yeah, no problem. I think it also ties into the fact of what we talked about earlier, what Asta was mentioning about like being an expert and trust in science and stuff
Mhm.
like that. If you can make yourself more relatable, people are more likely to stick with your content. And so that's something I try to do in online spaces, is make myself just like another like average person who tends to have a lot of knowledge in one specific area. And I do think that that resonates with people.